Hi everyone, this is Roshni Arun with the North Carolina Medical Journal. Today I'm interviewing Dr. Kathleen Welsh-Bohmer, an appointed professor of psychiatry and a professor of neurology at Duke. Dr. Welsh-Bohmer is also the co-director of the Outreach and Recruitment Core for the Duke UNC Alzheimer's Disease Research Center, director of the Alzheimer's Disease Therapeutic Area at the Duke Clinical Research Institute, and a faculty member at the Duke Institute for Brain Sciences. In this interview, I'll be talking with Dr. Welsh-Bohmer specifically about her role in establishing the NC Registry for Brain Health, where she serves as a co-leader, helping to provide people around the state of North Carolina with information about brain health, dementia prevention, support for caregivers, and opportunities to participate in clinical research related to brain health. Dr. Bohmer, can you start off by giving us a little bit about your background working in clinical research and studying aging, memory disorders, and preclinical and early stage Alzheimer's disease?
Sure. Yeah. Thanks, Roshni, and thank you for inviting me to talk today. This is great. So I'm a clinical neuropsychologist by training. That means I've trained in psychology with a specialization in what can go wrong with the nervous system and creating memory problems. And I've been here at Duke on the faculty since the late 1980s, actually, so quite a while, working with a broad team of clinicians and scientists to understand the biology of Alzheimer's disease and to develop treatments and prevention strategies. So my early work began with Dr. Alan Roses, a neurologist who was at Duke and focused on the genetics of Alzheimer's disease. Now, back in the 1980s, that was a pretty revolutionary idea, very novel. There was very little credence in that genes were playing a major role in the disease. But that's all changed now by studying families that were living in North Carolina in whom Alzheimer's disease appeared to be affecting many generations in those families. We were able to identify a gene called apolipoprotein E, that's a mouthful, but ApoE for short. And we now recognize that that's a major gene contributing to the risk of developing Alzheimer's disease. Now, you might ask, why am I telling you all of this? The reason that this was so important is that it gave us a strategy for being able to study people who might be at risk for developing the disease and then develop ways to diagnose it earlier, because we could look for people who had the gene that was increasing the risk and then develop better tests for detecting it early and then eventually developing therapeutics. So it really just changed the field entirely and allowed us to be able to study what we call preclinical disease before the symptoms even begin to express. So really exciting times dating all the way back to the 80s, but have taken us to where we are today, where we now actually have a couple of treatments for Alzheimer's disease.
Yeah, absolutely. I think it's really interesting to hear about how your scientific background has essentially led to your interest in more education and accessibility. And regarding your previous work, I think, genetic and biomarker identification is such an important and growing field, especially now when we're pushing towards precision medicine and non-standardized care. Being involved in
Absolutely.
research myself, I think I've noticed how scientific benchwork is only half of the battle, and the other component is actively going into the community and disseminating information, like you're doing with the Brain Health Initiative. And kind of in that vein, can you tell us about how the NC Registry for Brain Health began? And as a co-leader of the registry, what inspired you to become involved with this particular initiative?
Yeah, so I'll take you on that journey because it was a journey to get to where we are today. So the North Carolina Registry for Brain Health grew out of an interest that our research that we were doing would include the populations who are at the highest risk of developing the disease, and out of an interest that the results that we get would generalize to the communities we serve here in North Carolina. That meaning, the diverse communities, men, women, rural, urban, and all ethnicities. So in 2009, we were getting ready to do a really big prevention trial. So it was on the horizon. We knew we were going to do this, but we had a challenge. And the challenge was, we know exactly where to go if we're going to do an Alzheimer's trial where some patients have symptoms. We go to a memory clinic. But here we're doing a prevention trial. So we're preventing it from starting. And where do you go to find a clinic of healthy people who don't have symptoms of a disease who want to get involved in your study? There really was no feasible clinic for that. So, to solve this problem, we decided we needed to really reach out to the community, to the people who are healthy, not having symptoms, and ask them to partner with us in our research. And that became the genesis of what we called at that time the Alzheimer's Disease Prevention Registry at Duke, or the ADPR for short. And our goal here was to ask the local community to help us in our research and to sign up for the ADPR and get involved in Alzheimer's prevention studies. You know, this big one maybe that was getting ready to launch, but all sorts of other studies that were all designed towards trying to delay the symptoms of Alzheimer's disease. Now, the other problem that we had was that, first you had to identify a eager group of people who wanted to get involved. But getting people involved, we also wanted to make sure we got lots of different kinds of people involved, not just convenience, people of convenience, but, the whole population. So we wanted to get our message out to the whole community. At that time, about 37% of our local population in Durham identified as African American. But in our studies, less than 10% of the participants identified as either African American or Black. And that was concerning. If we're going to try and represent our local community and we're not getting our local community engaged, that's going to be a problem. The other concern that we had is that there were new data coming out at that time, and this has been confirmed in later studies, that African Americans are about a twofold higher risk of developing Alzheimer's and related dementias. And so this made us realize that if we're going to be trying to develop treatments to prevent Alzheimer's disease, we're missing the key group to be in our studies. And we need to make sure that our research includes people who are at the highest risk. And so we had to come up with a strategy that was going to allow us to get into the community and get people involved, particularly people who are a little reluctant to get involved. And so as we built this new Alzheimer's Disease Prevention Registry, we partnered with the African American Community Outreach Program, which was at Duke and headed by Reverend Henry Edmonds. And through his collaboration and his network of faith-based communities, we were able to successfully put together what I call a research-ready group of people. These are people who said, yeah, I'm interested in potentially getting involved in research. Put me on your list of people and we'll partner with you with research studies. And so we then built what we call the Alzheimer's Disease Prevention Registry at Duke. In 3 years, when we started this initiative, it numbered over 5,000 people, of whom 38% identified as African American. And that ADPR that I've just described to you back in 2009 through 2012 demonstrated, it was sort of a feasibility project, if you will, for the later registry. It demonstrated that the community and populations of color do indeed want to get involved and informed about brain health research. They just need to be asked and know what the opportunities are to get involved. So then fast forward to 2015, Dr. Goldie Bird, who was then at North Carolina A&T, along with the Institute of Medicine and AARP, were pulling together a task force to develop the state plan for North Carolina for Alzheimer's disease. And I was invited to be a part of that group. And we suggested at that time that we could take this ADPR model that I just described and make this a statewide effort. Instead of it being locally to Duke and to Durham, we could develop a similar registry that expanded out to the statewide level, would represent the entire state, and would allow people from across the state to hear about research and get involved in research if they wanted to. So it was really about increasing knowledge and accessibility of research across the state. And so that was how the North Carolina Registry for Brain Health got its birth, and why we're so passionate about it. It's really representing all of North Carolina.
Absolutely. That's so inspiring, Dr. Welsh-Bohmer. I think,
Thanks.
it's really such a blessing to be able to have scientists or professionals in the field get involved in, scientific advocacy to help really disseminate the importance of the research with the broader public. It's also really great to see that the genesis of this work was developed from your own kind of clinical work in identifying a discrepancy in prevention trials. And now, almost 20 years later, it's great to see how the registry has grown and continues to grow. Kind of in more of the foundational aspects of the program, what are the registry's goals when it comes to improving brain health across North Carolina, and how does the registry differ from other brain health or dementia initiatives nationally or statewide?
Yeah, those are really great questions. So the fundamental goal of the registry is to accelerate brain health research in North Carolina, full stop. That's the main goal of it. And the way we attempt to do this is to give the people across the state, particularly underrepresented groups in research, access to research, opportunity to get involved if they want to get involved. So a big part of this is really to just make sure North Carolina is on the cutting edge of research. We were facilitating it, and we're making sure that people know about it and have the opportunity. Now, another big part of the registry, so that's really the main driving goal behind it. But another really important part of the registry is empowering personal action. So we now know that there's a lot that we can do to prevent cognitive disorders and to delay onset of symptoms. And so a big part of our mission is getting well-vetted information out to the public about the medical advances that are occurring in Alzheimer's disease so that people can take charge of their own brain health and try and optimize their health to make sure that they delay or prevent memory problems if they're able to. So that's the fundamental goals behind it. It's really about making sure research is able to go forward and include all people and to get information out to people about what's happening so that they can use that information for their own benefit. So that's sort of the joint goals. How we differ from other registries. So there are a lot of registries that are national or global Alzheimer's registries that are basically doing the same job about trying to get people involved in research. But where we differ is that we're entirely focused on the state of North Carolina. So with our mission here is to improve the brain health of North Carolinians. And we're really focused on facilitating research here in the state. So our research that's going on at Wake Forest or Duke or UNC or ECU, North Carolina A&T, and others, it's really to facilitate that research that's going on here locally. And also then to translate all that we're learning about brain health back into the community so people can use that information for their brain health. Importantly, this is free. It's just basically signing up for a listserv that provides information to people. We send out basically on a monthly basis, we send out what are called e-blasts to people that provide information about what's going on with research studies. And then we send out a quarterly newsletter to people as well as invitation to get involved in newly enrolling studies as those become available. So it's really a very low touch approach, but it's really to provide that information to people and get them involved.
Honestly, that's such a helpful resource, Dr. Welsh-Bohmer. Just the idea that the registry is not just for enrolling participants in studies, but also focused on educating people, providing resources, and making research accessible to underrepresented communities as well in North Carolina, I think are all, incredible feats. I also really appreciate how you mentioned it kind of emphasizes personal choice and, a low pressure environment and involvement, which, can almost seem like it encourages broader participation. But on top of just disseminating knowledge, we were curious to know, the NC Registry for Brain Health's focus on engaging people with the clinical research opportunities is really interesting to hear about. So we were interested in learning more about what kind of opportunities does the registry create for both registry members and researchers in North Carolina?
Yeah, sure. So a big part of what we do is exactly what you pointed out, which is to offer different studies to people. And these are studies that are focused specifically around an individual's own brain health. And some of our studies are actually caregiving studies as well. So the people who sign up for the registry, many of them are not having memory problems, but often are concerned about it, maybe have had a family member affected. And so they have their own personal reasons for wanting to get involved in brain health research to benefit themselves and their families. Some of the people who join have memory problems, and some of the people who join are actually caregivers to people who are having memory problems. So our portfolio of studies that we offer are studies that are around brain health and prevention. There are some studies that are for trying to improve memory in people who are already having memory problems. And then there are some caregiver studies. So right now there's approximately a dozen actively enrolling studies that the registry is supporting. And as I mentioned, some of those are for improving brain health. Like we have one that's looking at dance and music for people who have memory problems already. And then we have other studies that are looking more at prevention. One's looking at a ketogenic diet and its effect on brain health. And then we have some studies that are looking at how can we better diagnose the illness early. And so we have a couple that are focused on new biomarkers that might help us identify the disease in a way that can be done non-invasively. So we have one that's actually looking at imaging the retina in the eye just to see if there's any evidence of the biology developing by looking at the eye. So these are, some of the offerings that we have. And as I've mentioned before, we send that information out to our members so that they can hear about it and consider whether they want to get involved. And then beyond that, we provide to our members these monthly e-blasts that I was talking about. So that's sort of a concise email that encapsulates the latest breaking news in brain health, and it's news from across the globe as well as local information. And then we talk about resources that are available locally. So our members get that. You asked about our researchers and what they get when they are involved with our registry. So for our researchers, we offer them an ability to connect to people who want to participate in research. And that's, I think, one of the things that's really rate limiting for people doing research is that getting participants to agree and partner in research can often be slow going. And so if you already have a group of people who are interested in getting involved in research, you have a group you can go to and ask if they're interested in your study. So it offers a way for people to quickly connect with potential participants in their study. The other benefit for researchers who are involved with the registry is that our registry then is highlighting their research when we're communicating out with our members. So when we send out our e-blasts, some people will be interested, but then they'll pass our e-blasts on to their friends or to their communities. And so it's a way to publicize some of the research that's going on for those researchers. And then we also, of course, post descriptions of their research on our website. So for people who are not in the registry, who just go to our website, they can see the work that's going on here in North Carolina as well. So I think there's a lot our members get out of being in the registry, and then there's a lot that our researchers who decide to, put their studies out there as offerings in the registry, they get a lot out of it as well. So it becomes a really nice relationship for both, I think.
Yeah, absolutely. I think this is such an amazing resource for individuals, both on the general public side and, as you mentioned, the researcher side. I think having a dedicated platform for brain health is super encouraging for those who may not be as familiar with, using clinical research databases like PubMed or clinicaltrials.gov. On that note, can you talk about a specific example of how participation in the registry contributed to advancing dementia or Alzheimer's research in North Carolina?
Yeah, so I mean, we've supported, I think, over 24 studies at this point. And I would first point out, before I get into actually what you're asking in terms of what we've done, the registry is now probably close to 16,000 people. So here in 2026, we have about 16,000 people who are in the registry. And about 45% of the people that are in the registry identifies coming from a racial group other than white. So we have a very ethnically and culturally diverse group of people who are interested to be involved in research. And why that's important and what that has contributed to the science is that we've now got a much more representative group of people that are interested in getting involved in research. And getting back to what you were talking about at the top of this interview about precision health, you really want to make sure you've got people from all walks of life involved in science because you're trying to look for therapies and try to discover things about disease that represent all people, not just a very select group of people. And so I can say that with confidence that the registry has been very successful in helping researchers represent the real world in their work. And so that's probably one of the biggest contributions of the registry since it's been started in 2019. The other part is that the registry has actually done a great role out in the community in terms of increasing what I call research literacy across the state. So I think people have heard about research, and particularly during COVID, I think research got a lot of attention. But there were a lot of fears and misconceptions around getting involved in research and what research meant. And so I think that the registry has done a great job of getting out in the community and trying to educate about what research is all about, give examples of different kinds of research studies that are going on, and really trying to dispel some of those myths so that if people do want to get involved, they can get involved and they understand what it's all about. And so we've been doing that a lot through our outreach work that we've been doing, and we've been doing webinar series with the Alzheimer's Association and the Wake County Public Libraries. And in that series, for example, we talk about the fundamentals of research, how people are protected so that nothing bad happens to them while they're involved in research. And we really try to get good information out there to the community as to what it's all about. So I think that there's been some really great successes from both the scientific contributions that have come from the registry, but also in terms of just general education of the community about research and in terms of, what's involved with it and dispelling some of those myths.
Absolutely. I think it seems like the registry serves as a very crucial connector in the research world. A lot of times the challenges with clinical studies or research studies is there's a gap between the science and the way it's communicated. So it's really exciting to see that the registry is working to bridge this gap. In that vein, I think that, one of the most important contributors to success in scientific research is collaboration. So we were interested to know more about, the strategies that have been most effective in connecting diverse communities with research opportunities across the state.
Yeah, I mean that's a really good question. I mean, we basically started by trying to have very candid communication with the communities, and in order to do that, I mean we've used digital campaigns, of course, like Facebook and web pages, but honestly, the most effective ways of connecting with communities, particularly with diverse communities, is just to be out there in the community. And so this has been with basic old-fashioned boots on the ground community engagement work. So we meet with people where they are in the community and invite them to get involved and tell them about what the registry is doing and show them the different studies that are going on. So we have teams of coordinators and even our investigators who will hold community events. Typically, we'll actually partner with groups that are already out in the community. We'll do things like health fairs where we can, talk about the research that's going on in brain health. We can usually dive in and describe the different studies that are actively enrolling so people can get a real sense of what's involved. And then, flyers that we can give them so they can read and learn more about it. And this often generates a lot of interest in learning more. And it also leads to a kind of a spreading through word of mouth of what's available. So we often will hear from people that they heard about us at one of these events, or they had a friend or a family member pass along a flyer from one of those events and they were interested in learning more. And then beyond that, we've done these programs, like I mentioned it earlier, that create some enduring content. So we've done these library webinar series, and that's been really effective as a way to engage different communities. And it's done, we usually hold them in evenings so people can attend while they're at home, but then they can always go back to the resource libraries and learn more. And then Wake Forest and North Carolina A&T have been really good at putting on what we call caregiver colleges. And these approaches have helped introduce numerous families across North Carolina into research while providing them with access to support services that caregivers really want and need. So our approaches have really been to engage directly with the community as much as we can, to listen to what they want and need and make sure we're addressing that as we're trying to get our word out about research and about brain health.
Yeah, definitely. I think, it's great to hear that you're taking a comprehensive approach to using, digital media and also word of mouth to get information out there. I think that the library webinar series is also such a great opportunity to kind of, immortalize the information on a shared digital platform. It kind of gives opportunities to individuals to go back and do their own research. Slightly switching topics here, we were interested to learn about how, representation is encouraged within the Brain Health Network. So how does the NC Registry for Brain Health work to ensure that people from underrepresented backgrounds feel included and empowered to participate in brain health research?
Yeah, that's also a really great question. We were really sensitive to that, from the very beginning. Like even when I talked about the ADPR, which was the first registry that started this whole program, but we knew that people are naturally curious about research. Actually, when we get out into the community to talk about it, people are interested in hearing about it and hearing more about it. But that's also kind of balanced by a level of caution. So, there's a long history of research abuses, particularly research abuses that have occurred within minority communities. So, Tuskegee being a key example of one. And so, there's a long memory of that, rightly so, of how communities of color have been taken advantage of in research. So we're very, very aware of that and cautious when we were taking our own approach and going into the community. And we've been fortunate to be partnering with my colleague and co-director, Goldie Bird, who's done such amazing work in terms of getting us out into the community. And our approach is that when we reach out to communities, that we make sure that we're bringing our faculty and coordinators who are from within the community out to do that work so that they can have candid, authentic discussions about research and about the concerns in a protected way by people who are trusted and credible and accountable to the community. And so that's been a big piece of it, is making sure we have people who are really trusted, who are doing the research, get out there and talk about it so that they can talk very candidly about the concerns that people are having. And then once people are in the registry, we also pay attention to make sure that we're addressing what's important to them as they get involved in research. So we're constantly evolving to make sure we're improving what we're doing and meeting the goals of the community as well. So we're always listening to what our research participants are telling us, what studies they've liked, which studies they want to get involved in, how the registry could be better for them. So we also make sure that the content that we provide in terms of our e-blasts and whatnot address relevant questions to all communities. And so we'll hear from the community what are the stories that they need and want, and we'll make sure that it's covered in our materials that we provide.
Yeah, I think, that's such a great approach. I think, especially in conversations surrounding representation and just general support, sometimes hearing the raw stories and the raw narratives of individuals in these communities speak a lot more than just statistics or numbers. I also think that it's great that the registry provides continued support after individuals sign up to kind of ensure that there's guidance in how to make most of the resource. And in interacting with these individuals, what are some of the barriers that you have noticed through your work when it comes to people participating in clinical trials or caregiving or even receiving care?
Really, I think the biggest barrier when I'm focusing in, I think, on your use of the word clinical trials, because clinical trials have been probably the hardest kinds of studies to recruit for, largely due to the reasons we were just discussing in terms of the historical abuses. But to be honest, the greatest barriers to getting into clinical trials these days, I think, are actually in the inclusion and exclusion criteria of the studies themselves. And I think that's something that we've been really working on with the investigators who are offering studies. So, inclusion exclusion criteria, that's, things that you have to have or things that would exclude you from the study. So there's often good reasons for those inclusion exclusion criteria for a study that's testing a new drug. For when you're testing a new drug, you want healthy people in the trial, except for the condition you're looking at. So you want people who have, for example, Alzheimer's disease, but are not having significant heart disease or other problems going on, because you don't want to have any complications, potential complications as you test out a new drug. Well, that makes sense that you might have these inclusion exclusion criteria based on health conditions. But a lot of times it excludes a lot of people in order to get the few that are going to qualify for the study. And there can be other things in the study design in the inclusion and exclusion criteria that also eliminate people from being eligible. Things like they need to have a caregiver who will come with them to the clinic, or they need to come to a clinic that's far from their home during business hours. Well, that's going to exclude a lot of people who are working, a lot of people who don't have a family member who can come with them. And so we've been really trying to address, this is not just the registry, but the field in general has been trying to address how can we counter these problems so that research is more inclusive. And lots of new developments have happened here, with the advances in digital technology and the ability to do telemedicine. We're able to do some studies remotely now. And some of the studies that we offer in the registry are actually remote studies. Other ways of overcoming this problem of too inclusive, the criteria being too exclusive, I should say, is, making sure that the research study is done closer to where participants live or at hours that work with their schedules. So I think some of the biggest barriers to research have been created by the researchers themselves. And we're now countering that with being creative and listening again to what our participants need. We're partnering with them. If it means bringing it closer to home, doing it after hours, doing it remotely, those are all things that will still advance the science and allow everybody to have a great experience.
Yeah, absolutely. You talked a little bit about how you're using technology to kind of encourage better design. And I think, using technology to make a platform more accessible or more comprehensive is such a great approach. I think, especially now with the advent of AI,
Yeah,
I'm
right.
sure there's going to be a lot of conversations, surrounding this topic about how patient identification for clinical trials can be automated. So it's great to see that there's ongoing efforts to kind of align, your efforts towards the current technology. But you're definitely still right that there's a lot of discrepancies in how these thresholds on criteria for inclusion, exclusion are established and how we can better outline these thresholds so they can be translated to a
Yeah.
larger population. But on the topic of a little bit of a slightly different vein of collaborations, what partnerships have been the most meaningful or impactful? And how has the NC registry impacted recruitment for dementia research in particular?
Yeah, so the collaborations that I think that have been just amazing and having such a huge impact are really from the 5 academic sites that are involved in this collaboration in this program. So our Wake Forest site, which is led by our co-director, Goldie Bird, she brought with her, as the former executive director of the Maya Angelou Center for Health Equity, she brought that collaboration with her own center that she was helping to direct. And this was bringing us extensive connections into the communities. I was kind of talking about that before. The communities that are most severely impacted by these conditions, African Americans, Latinos, and Native Americans. She was able to, through her collaborative network and through the work she was doing, able to get us into these different communities so that we could get the message out about the importance of getting involved in health research and why that's important in particular to those communities. And then when we moved to North Carolina A&T, that site is being led by Ashley Sanderlin. And She has a unique collaboration with a program there called Coach. So Coach is spelled C-O, and then it's AACH, and that stands for the Center for Outreach in Alzheimer's, Aging, and Community Health. So by her collaboration with Coach, she's able to bring in strengths that get us into the community there locally. And we're able to then benefit from their programs and their health education programs and their caregiver programs. So again, those two programs of Wake and North Carolina A&T have allowed us a lot of inroads, in particular within minoritized communities. Then when we go to ECU out on the coast, that team is being led by Russ Price, Dr. Russ Price, and his group has been able to support the registry's goals through their strengths in health education. So they've been leveraging their relationship with what we call the North Carolina Area Health Education Centers, or AHECs. So ECU has been increasing our visibility with the health workforce that support patients. So, RNs, primary care, physical therapists, occupational therapists, all in the rural communities of North Carolina, to be aware of the registry, what we're doing, so that those health providers can then work with their patients and say, yeah, this is a reputable program. This is actually funded through the state. Yeah, you might want to consider it. So that's been really, really effective. Our UNC site is led by Dr. Garuf Davi, who brings strengths not only in community health, but also in data science. So they've got this unique abacus program, which allows continuous improvement in research programs. And so they can do evaluations of the work to make sure that what we're doing is meeting the healthcare needs. So that is really key. And we're just beginning to actualize some of that because he's just joined the project here recently, but very excited about what that's going to do in terms of us being able to iterate what we're doing and improve over time. And then here at Duke, our team here at Duke has a longstanding history of being involved in epidemiological or big public health studies. So we bring that expertise from Dr. Brenda Plassman, who's heading up our coordinating center, as well as the research that I've been doing with registries and in preclinical disease. And in my role with Duke Clinical Research Institute, we're being able to really use that connection as a key partner in providing expertise in health communication that then can help us improve public health across the state. So I think, these collaborations amongst these 5 key partners has been really important and meaningful and impactful in getting the word out. And I think that between these 5 sites, we've been able to do so much more than any one site could do alone in terms of being able to cover the entire state of North Carolina. And that's improved the recruitment across the state.
Yeah, absolutely. These all seem like great collaborations. And it's also great to see that there's such a diversity in, the institutions and the disciplines represented in the collaborations across the state. And I think the approach that you're taking is such an effective way in the sense that, it's almost being done in a systematic way, working to connect with patients and scientists in every step of the way. And now from a little bit more of an educational standpoint, what do you think are some simple steps people can take today to support brain health across NC and to engage in their own brain health?
Yeah, I love talking about this actually. So I think there's probably 3 key areas that people can tackle right away, and they're very well supported by a strong research literature as being effective. So first and foremost, the first step is just getting physically active. So, time and time again, the research studies are underscoring that physical activity is really important for brain health. And this can be anything from walking, swimming, Tai Chi, yoga, anything that really can kind of get the heart rate up is really important. And we're seeing that by improving cardiovascular health, we're also improving brain health. And that can also build strength and prevent or reduce the possibility of falls, which also, of course, has a potential bad effect on brain health. And so things that people can do right away in terms of getting physically active is to just basically what we would say is, stand up. It's really about just getting up, and if people are physically able to do it, to be able to get up, get out of the chair, and get vertical throughout the day. So getting up and moving every hour, just, if people are sedentary, to make sure that they're taking that small step. The American Heart Association recommends 150 minutes of moderate physical activity during the week as the optimal for both heart health and for brain health. So that's about two and a half hours of activity per week. And that can be, like I say, walking or any of these other activities, but basically trying to get about 30 minutes a day in 5 days a week is what's recommended for physical activity. Then the second thing we can do is watching what we eat. So a balanced diet that's rich in fruits and vegetables, beans, whole grains, lean proteins, that's been shown to reduce inflammation and stress that can contribute to heart disease and to aging. So really trying to get these healthy fats like the omega-3 fatty acids that you find in fish, really important for supporting brain health and heart health. The diets that we typically hear about that are associated with it are called the Mediterranean and the Mind diets. People can Google that and find out about it. But there are lots of other diets that conform to that basic approach, which is to, stick to the fruits and vegetables and healthy foods. Um, Small steps that people can take is to really minimize their sugar and salt intake. So taking that salt shaker off the table and making sure they're not adding extra sugar into their diet. Eliminating or greatly reducing processed foods are another great place to start. And people will say, well, what does that mean? Like, what's processed? Well, basically sticking to the perimeter of the grocery store. So that would be is what's good for your heart is going to be good for your brain. So that will have less processed food. That is going to be your produce aisle, your meat and seafood section, your dairy and alternatives, eggs that you would find along the wall, whole grains and fresh bakery items, and some of the frozen staples. Those are going to be the things that are going to be the best for overall brain health from the dietary perspective. And then finally, the third thing that has been shown to be really effective is to use our brain, use it for what it's meant to be doing. So stimulating our brain by learning new things or engaging it in what it's supposed to be doing, which is thinking and being challenged in what it's doing. So educational programs and social activities are a great way to challenge our brain. So just getting out around other people can be really important because it challenges to track what they're saying, to think about what we're going to say next, to remember names, to do that while you're aware where you are in the environment. So those can all be really great things for improving our chances for a uh, healthy aging and good brain health. And brain games, people ask about that all the time. Those can be satisfying and allow some new learning. I think by itself, it's probably not going to have a huge impact. But if that's all that people can do, of course, try that as well. But really engaging with other people through social events, I think, is probably one of the biggest ways that we can engage our brain in what it's supposed to be doing. So those would be the three things that I would point out, exercise, diet, engage in the brain.
Absolutely. I think you bring up some really good points about, the approach that individuals should take to care for their brain. It really is a holistic approach that, encompasses all facets of their environment, in addition to just components like diet. And I think a lot of times some of these other aspects, like community or language comprehension or just the social interaction, isn't widely known to be preventative brain health. So it's great that the registry is making this information more accessible. How does the registry shift the conversation from treatment to preventative care?
Yeah, that's actually an easy thing to do, actually, to shift from treatment to preventive care. I think people are really interested in what's happening on the treatment front. They're really curious about what are the treatment trials that are underway. Do we have any treatments? Will we have any treatments? So people are already very curious about that, um, because they often have some knowledge of what Alzheimer's disease is like, either from a personal perspective or from what they've observed from just being out in the community. I think everybody has had some experience with dementia, whether it's from the media or whether it's from their own personal experience. But people don't want to wait around to when they're going to need a treatment. They like to know that treatments might be there if they're ever needed, of course. But people want to take control of their life and to try and reduce the risk of developing these conditions. And so talking about prevention is something that we do regularly as part of the registry. It's something that we can all embrace and make changes. Even if we're struggling with health conditions, there are simple things that we can do in our individual life to help promote our own brain health. And so we commonly talk when we're out in the community, or even if you go to our website, we talk about what are the 7 pillars of brain health. I've mentioned 3 of them already. I talked about exercise, healthy diet, and keeping the brain sharp. But the other 4 include reducing stress, which is easier said than done, good sleep habits, and managing your health conditions with regular medical checkups. So, part of good brain health is making sure we manage those other conditions as well that can interfere with our brain health. And finally, research involvement. So research involvement is one of the 7 pillars. It's about taking control of your health to the extent that you're comfortable doing it. So really early detection is important. That's why that medical, staying current with your medical conditions is so important, because health professionals detecting things earlier can then treat them more successfully. And so by focusing on these 7 pillars of what we can do, people are very, very eager to embrace that and to change their own lives. So that's been pretty easy to have those conversations, talking about what are the treatments available, but then what we can do until treatments are, fully available to everyone.
Yeah, absolutely. I think, especially now with chronic diseases like, brain-related diseases, cancer, age-related diseases, I think that we're seeing how important taking proactive action is in terms of just general health sustainability. So creating a strategy, like you mentioned, the 7 pillars of health really help outline what is necessary and what ways a general community can make efforts to kind of preserve their health or ensure their health long term. And our next question for you was, what misconceptions about brain health or dementia do you hope to get rid of through your outreach?
So the biggest misconception we're trying to eliminate is really around research, actually. So people often think of clinical trials or experimental therapies when they think about research. And even when they think about brain health research, they think they're going to be asked to be a trial that's going to test a drug. And, some of the key research that we're doing in brain health over the last several years is really more in the area of preventive health and improving the technologies that will allow us to better detect disease. So I want to point out the U.S. Pointer study, huge study that announced their results back in July about things we can do to prevent cognitive disorders. That was headquartered here at Wake Forest University. It's become like just a national, global phenomenon. It tested whether these lifestyle interventions that I was just mentioning, diet, exercise, engaging the brain, and taking control of your medical conditions, whether that actually does improve cognitive outcomes. So it put it to the test. And so people were randomized into a 2-year study where they got intensive health coaching on those 4 things. So they basically got a coach for 2 years about their diet, their exercise, their cognitive stimulation, and their medical conditions, and closely monitored and, really threw everything at that, gave them all the resources they needed and help. And then another group that got all the information but didn't have these like health coaches that were motivating them and keeping them on target. They had to self-motivate to do it. And what they showed at the end of 2 years is both groups improved in terms of their cognition. They both showed, cognitive improvements at the end of 2 years. It was a much larger effect in the people who had this intensive health coaching, but they saw it in the other group that was self-motivated compared to people who were not doing either of those things. And so that became really clear evidence that we can take control of these things in our lives and it can have an impact on what we're doing. So that's not a clinical trial with a drug. That's a clinical trial testing, things that we can do in our everyday life. Other studies that have been going on, at UNC, at Duke, at Wake Forest, look at the utility of Alzheimer's blood biomarkers in predicting disease or tracking change, tracking improvement over time. And those are, really exciting tools because if this pans out, it would give our providers ways of tracking their patients over time that don't involve these intensive examinations and lots of memory testing. It might allow us to track disease in a more biological and easier way. And then there are studies that are examining wearables like smartwatches and other digital tools like, smartphone applications that have ways of monitoring our health conditions, our sleep, our stress, and even provide some assessment of our memory changes over time. Again, these are all studies that are going on, and it's not involving drugs. So that's one of the things that I really hope we can dispel is that assumption that when we say research, we're talking about clinical trials, because a lot of what we're doing is actually these other types of either observational studies or interventions without drugs.
Yeah, absolutely. I think, a lot of the topics that you brought up comes back to the idea of precision medicine. And, oftentimes one of the biggest bottlenecks in precision care is that the therapeutics or medical treatment developed isn't based on representative data. So it's great to see that, there's such an evident push for more comprehensive research and data on different populations for biomarker identification and, as you mentioned, therapeutic development. And looking more ahead, what are your future goals for the registry and what new initiatives, outreach efforts, or research directions are you most excited about?
Yeah, well, as you point out, the big part of what we're doing is making sure that our research activities are accessible by all people for the reasons that you just cited in terms of precision health. We want to make sure that the research that we're doing includes people from all walks of life. We want to make sure that we've got all communities involved, as I've been talking about before. Right now, most research studies that are done across the U.S. involve, heavily a lot of women signing up for these studies. It's harder to get men into studies. They often are populations that are primarily white that are getting involved in studies. And so we really are emphasizing within the registry the need to get out into rural communities, to get out and get more men involved in the conversation, to get people of color involved in the conversation. And so in this next year, I'm really excited about us going what I call big. We're going big. So we're taking an approach where we're going to do a public awareness campaign across the state about the registry, really, using digital approaches to get the word out to, as I say, go big. And then we have other initiatives that I'm equally excited about. One is that we're focusing on our researchers at the institutions to make sure that they're aware of the registry. So it's not just the public at large, but that researchers are aware of what the registry offers so that they can provide really exciting new opportunities for people, and we can help them with their research recruitment at the same time. So really excited about that. And then really increasing the awareness within the community. We're planning some focus groups out in the community to hear more about what people want and need. And then we're hoping to take that information back in-house to improve what we're doing and also to help us connect our message more broadly across the state. So really excited about our Go Big campaign that we'll be seeing in the year ahead.
Absolutely, that is so exciting. We're also really excited to see how, these efforts continue to grow and very appreciative of the emphasis on accessibility and representation. And in your work as an educator and as a clinical researcher, what is your hope for the next generation of researchers and what is needed to make trials more efficient and inclusive?
Yeah, so some of this we've touched on in terms of things that can be more efficient. So, again, thinking smartly about the technology that we can use to make things more streamlined, more accessible to people, more appealing in general, But my biggest hope going forward, to get back to the first part of your question, as an educator, as a clinical researcher, what I really hope is that we have really robust next generation of clinician scientists that reflect our communities as well. I really don't want our upcoming generations of scientists, that may right now be in high school or in college, to get discouraged about entering the field. I really want to see that avoided. As a country, the US has been known as innovators of scientific research. It's been a reputation that has been envied and emulated across the globe. And for that innovation to continue, we really need that constant pool of really talented, passionate people with interesting ideas to get involved. And we've seen research cuts in this last year. We've seen a decrease in the funding opportunities. And I think that can be really discouraging for new investigators who are trying to enter the field. What I would say to folks is don't lose heart. There are so many opportunities at each of our partnering institutes to help keep college students and even high school students engaged in the scientific enterprise. And so I can say that our clinical translational institutes have programs at them. At Duke, I know we've got programs at Duke Clinical Research Institute for high school students and college students and medical students. We've got a program through the engineering school. We've got a program through the brain sciences school. And I'm sure that would be, you could probably say the same thing for each of the other institutes that are involved with the registry. Many of these programs, you just have to Google, high school research programs at Duke, high school research programs at Wake, and you will find them. Most of them start their application process in November or cut it off in November. For summer, usually it's summer sessions that they're offering, 6 to 8 week programs. But I'm saying that right now because I really do not want people to get discouraged. There are just so many opportunities out there that they can get involved in. And I would encourage the next generation to really be thinking about brain sciences. It's an exciting time to be involved. We've got so much momentum, but there's still so much we need to learn.
For sure. I think that in addition to the representation on the clinical trial side, we really need a diversity in perspectives of scientists who are, developing the science for treatments, developing the science for diagnostics and preventative care. And, coming from an undergraduate student's perspective as well, I think you're absolutely right. Encouraging a love for science and fostering that love really starts young, um, throughout high school, throughout middle school and undergrad. And, I think that it's great that there's such a push for this and, the NC registry kind of supports this message as well. One of our last questions for you is how can individuals or healthcare professionals get involved or support your mission?
Yeah, great question. I'm so glad you asked that. That's easy. They can join the North Carolina Registry for Brain Health by going to ncbrainhealth.org, and they can sign up that way. We also have an email address there, so they can email us directly. A lot of those emails come directly to me, so we'll get back to folks right away if they have questions or they want to know where we're going to be next or they want to talk about something. But yeah, go to our website and you learn more about us and get in touch.
Thank you so much, Dr. Welsh-Bohmer, for, sharing such a comprehensive overview of the NC Registry for Brain Health. It's really clear that the registry is not only advancing scientific research, but also empowering communities across North Carolina with the knowledge, the resources, and just opportunities to participate in the conversations. From fostering that inclusion and representation in research to also being very proactive about brain health strategies. I think the work that you and your collaborators are doing really demonstrate how science and public engagement kind of go hand in hand. And we really look forward to seeing how the registry continues to grow, inspire future researchers, and just make a tangible impact on brain health statewide. So thank you so much.
Yeah, well, thank you. It's really been great, and I really enjoyed the opportunity to talk about what we're doing in the North Carolina Registry. So thank you for that opportunity.